Hello everyone, I'm Dr. Carmen Keeley, and in this short video I'm sharing some key insights from a project focused on improving digital mental health support for young people across the island of Ireland. Our work looks at how digital tools like apps and websites, for example, can be used to support mental health. But more importantly, we want to explore how to make these tools better, especially for young people who are often left out of traditional support systems. Our first message is that Ireland's youth mental health system needs some serious innovation and reform. Right now, more and more young people are struggling with their mental health, but the support they need isn't always easy to find or access. There are effective research-backed approaches out there, but the way these are put into practice is inconsistent and often confusing. And at the same time, as we know, social media can spread a lot of misinformation about mental health, and this can leave young people feel unsure about where to turn or who to trust. Our second message is about digital tools. Mental health apps and websites can offer valuable support, and especially for young people who can't or do not want to access in-person services. And this can be especially true for marginalized young people who may feel excluded or misunderstood in traditional systems. But research shows mixed results. Some young people don't use digital tools because they find them impersonal, irrelevant, or hard to trust. And worryingly, some apps can even cause harm if they aren't based on real evidence or haven't been tested properly. So while digital supports show promise, they won't make a real difference unless they're engaging, inclusive, and built with care. And that brings us to our third message, namely co-production is essential. We all know that mental health is deeply personal. It's shaped by someone's background, feelings, experiences, and identity. But most digital tools aren't really designed with this in mind, and too often they are developed without the input of the people they're supposed to help. And that's a major reason why young people, and especially those from marginalized groups, don't use them. But when young people are involved from the start, and by that we mean when they help design, test, and shape the tools, those tools become more relevant, more trusted, and more effective. So what did we do so far? First, we listened. We established an all-island advisory board with members of support services, but also an all-island reference group of young people aged 18 to 25 to guide the project's development. We engaged directly with young people and services that support them across Ireland, and we asked them about mental health challenges they face and what kind of supports they are already using. Here's what we found. Young people see digital tools as a double-edged sword. On one hand, they can offer connection, support, and coping strategies, but on the other hand, they raise serious concerns like data privacy, misinformation, addictive use, and also the coldness of AI-driven content. What young people really want are tools that are trustworthy, culturally sensitive, and help them manage emotions or connect with others. Our second action was to co-produce a digital resource using Google Sites. So together with young people, we gathered and reviewed existing digital mental health supports like apps and websites that address the identified mental health challenges. And we are now getting young people to test them to see how relevant, trustworthy, and easy to use they really are, especially for young people who are often marginalized or underrepresented. And this isn't just an academic exercise. The insights we gain will be informing how practitioners, educators, and policymakers think about the use of digital mental health support for young people in their work. It's really all about improving how we deliver these supports, who they're for, and how to reach the young people who need them most. And finally, what impact are we trying to have? Right now, mental health policies and strategies across both Northern Ireland and the Republic of Ireland are really pushing for more digital supports. But if we don't design those tools with young people, we do risk wasting time and resources on solutions that won't be used. So what this project really wants to ensure and highlight is that future digital tools should not just be available, but also accessible, inclusive, and meaningful. And by putting co-production at the center, We are trying to promote building a system where every young person, no matter their background, can find supports that actually works for them. Thanks for watching, and to learn more about a project, visit the link on the screen. Let's keep working together to support the mental health and well-being of young people through innovation, inclusion and youth voice.